Please know, as always, this is not medical advice. This is for informational and educational purposes only. If you do want to incorporate anything that we're talking about or do further investigation, consult with your healthcare practitioner before implementing anything that we do discuss.
It's really hard to determine if can you reduce the amount of plaque that's already there. Maybe, maybe not. It really depends, again, on how good you are with your diet, how significant it was to begin with, and then what other things that you're doing. One strategy that I've brought up multiple times before in the past that I really recommend if you have known coronary artery disease is to start a supplement called vitamin K2. We really recommend to get that in 400 to 600 micrograms per day amounts, and that will actually help pull the calcification out of the plaque of those arteries. So that can be helpful in reducing that. The part where the diet really comes into play is lowering the inflammation. And so where that comes in when it comes to heart disease is if we have inflammation in the vessels, plus some buildup in the plaque in the arteries, that's the deadly combo that causes the rupture, that causes the clot, that causes the heart attack. And so the real benefit of the diet there is to reduce inflammation, and therefore your chances of having that event, which would be a heart attack in the long run, it reduces your chances of that happening. And so that's where the diet really plays a role. Fasting is such a powerful tool when it comes to strategies we use, but it is very problematic with some of the common medications that we see in people who feel the need to adopt an insulin smart diet. So metformin is probably the best example. Taking metformin on an empty stomach really does not work out well for patients for the most part. Again, as Matt said at the beginning, make sure you talk to your doctor about this before making changes to your medications. For me, a lot of times I'll just have the patients hold something like metformin until their first meal of the day, rather than trying to take it during their fast. If that's not an option, there's really two strategies that have been recommended, and this is by Jason Fung, who's kind of the fasting guru out there. One, soak some chia seeds in water, let them hydrate and swell up, and then take your medications with that. That will not technically break your fast, and it allows you to take the medications without the upset stomach that can occur. If that doesn't work for you, the other recommendation is to just take like a handful of leafy greens and take your medication with that. That as well will not break your fast.
Please know, as always, this is not medical advice. This is for informational and educational purposes only. If you do want to incorporate anything that we're talking about or do further investigation, consult with your healthcare practitioner before implementing anything that we do discuss.
It really just depends on what your problem is when it comes to glucose. Are you severely insulin resistant? Berberine is going to be very, very helpful in that case. Are you now insulin sensitive, but you want to moderate your glucose to a better extent? Probably the apple cider vinegar is the better option. Both of them are beneficial. Neither of them are harmful. If you have any questions at all, do them both. And so that should improve insulin sensitivity at the cell, just like the drug metformin. Berberine is a pretty powerful insulin resistant assist supplement. The other thing I really like to use it for is heartburn. So it really creates a more basic environment in the stomach. So if you're struggling with heartburn or trying to come off of your omeprazole or any other PPI, apple cider vinegar can be very helpful with that. Sure. So Ozempic is what we call a GLP-1 agonist. And so what it does is it helps in three different ways. It slows gastric emptying. It helps reduce or improve. And I actually was just talking to Dr. Bickman about this yesterday, and I don't think I actually got a real clear answer, but it helps with insulin production in order to help lower blood sugar. So theoretically, this shouldn't be what we're aiming for with insulin lowering diets, because we should be able to make more insulin. But anecdotally, I have several patients that I have prescribed or have come to me with Ozempic. And I think that in my opinion, it just makes the beta cells work more efficiently. And so therefore, we're not making more insulin, we're just more efficient with the use of our insulin. And therefore, if we're not making quite as much because we're not just spitting it out all over the place, then that's where the weight loss component comes in. So when it comes to Ozempic and fasting, the one comment I get from all of my patients is how much their appetite is suppressed with Ozempic use. So it's going to make your fasting easier. When it comes to actual insulin resistance, The only benefit there is because you're fasting, you're improving your insulin resistance. It's not the Ozempic. The Ozempic doesn't have any effect on the cell when it comes to the resistance to insulin, if that makes sense. And so really what I would say, if you're with the question with the herbal use, I would incorporate berberine for sure in that picture. Stay on your Ozempic, try to minimize the dose because there's really only a very small range of dosing that we have. Keep the dose as minimal as possible, and then use that benefit of the appetite suppression to maximize your fasting abilities.
Please know, as always, this is not medical advice. This is for informational and educational purposes only. If you do want to incorporate anything that we're talking about or do further investigation, consult with your healthcare practitioner before implementing anything that we do discuss.
I think learning how to talk to your doctor can be in an effective way can be really helpful. Like Matt said, in our free preview course, we do have a section in lesson 12 about talking to your doctor. There's a letter that you can give them if you're working with us to explain our program, as well as just some content in there to help you navigate that situation. One of the most effective things, I think, just tell your doctor, okay, I get that you're not super thrilled about this, but I want to experiment with it. So work with me for a few months, work with me for 3 months, and let's see what happens. Yeah, check out the free preview course. There's plenty of content online. DoctorsToTrust.com is another great source of video clips that you can share with people. So this company has done an amazing job of shortening content and taking out the great little nuggets. So if you have people who won't listen to an hour show, you can send them one of these videos, that are 5 or 6 minutes, and that can be really helpful. So check that out too.
A couple other resources that I can add to that would be, if she really wanted to become more educated in it for herself, she really wants to go this other direction of medicine. Obviously, read the book, get her the book as a gift, The Why We Get Sick. I mean, for a lot of providers, it is very, it makes a huge difference in their mindset of, oh my gosh, insulin really is this thing that we can manipulate through lifestyle change. A course through Nutrition Network, they have a wonderful short course that isn't too long. It won't take up too much of their time, and it is approved through the agencies we need to be approved through. The other one is to get on to the Society of Metabolic Health Practitioners. They also have some credentialing and accreditation programs there to help teach and then also give opportunities for doctors to be more well educated in this.
Diet Doctors added a course for doctors as well.
I've done that one actually too. So, and that one's 3 credits and it's free. And so really that's an easy one to get doctors to do.